Hi everyone. Today in this video let us discuss Olmesartan. Blood pressure is one of the essential conditions to maintain the daily activities. But when this blood pressure is elevated, it may lead to so many types of cardiovascular complications. The elevated levels of blood pressure may encourage the formation of atherosclerosis in those patients with elevated levels of cholesterol. And this atherosclerosis can block the blood vessels, resulting in development of stroke or cardiovascular complications like tachycardia, atrial fibrillation, and finally myocardial infarction. So all these cardiovascular complications are linked with elevation of blood pressure. The blood pressure can be controlled by so many types of drugs, and one group of drugs are acting on renin-angiotensin-aldosterone system. This renin-angiotensin system involves so many types of organs, even it is linked with renal system. But many of the organs are linked with RAS. Lungs play an important role by producing the ACE enzyme. Kidney is the other organ which is going to produce renin as the enzyme. And liver is the third organ which is going to produce a precursor for angiotensin system. From the liver, one of the precursor that is going to be produced is the angiotensinogen. This angiotensinogen can be converted into angiotensin 1 by one of the enzyme renin. So kidney can produce this renin which is going to convert the angiotensinogen into angiotensin 1. Now this angiotensin 1 is further converted by another enzyme ACE, angiotensin converting enzyme produced from the lungs. By this conversion they produce one of the mediator which targets blood vessels. So now ACE can convert the angiotensin 1 to angiotensin 2 which is going to act on the blood vessels to produce vasoconstriction. So this increases the blood pressure which increases cardiovascular complications. That's why one of the target to control the blood pressure is to inhibit the activity of renin-angiotensin system. So many drugs are acting on RAS, but one group of drugs are sartans. These sartans can block the renin-angiotensin system by antagonizing the angiotensin receptors. So they are commonly called as angiotensin receptor blockers. So Olmesartan is having the suffix sartan which is a ARB angiotensin receptor blocker. This drug is given as an ester Olmesartan medoxomil which can be given either alone to control the blood pressure, otherwise it can be combined with few of the diuretics like chlorthalidone or hydrochlorothiazide. So Olmesartan can be used either alone or in combination to reduce the blood pressure in the hypertensive patient. So today in this video we are going to see how this drug acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. First of all, let us see the chemical nature of this drug. So this is the structure of Olmesartan. Olmesartan is having the imidazole nucleus. Let us give the numbering. This is 1, 2, 3, 4 and 5. So it is having carboxylic acid at the fourth position which forms ester to form Olmesartan medoxomil. If we write the IUPAC name for this drug, we can write the suffix as imidazole 4-carboxylic acid. At the fifth position, it is having the propane 2-aryl chain with hydroxyl group at the second position. So 5-2-hydroxypropane 2-aryl. Similarly, at the second position, it is having the propyl chain, so 2-propyl. Third position, methyl chain is attached. This methyl chain is further attached with phenyl ring, and this phenyl ring is having the fourth position another phenyl ring, so 4-phenyl. And now to this phenyl at the second position tetrazole ring system is attached by fifth position. So we can write this as 2-2H tetrazole 5-aryl. That is a complete name of Olmesartan. So Olmesartan is a imidazole derivative with carboxylic acid at the fourth position which forms the ester to form Olmesartan medoxomil. Now let us see the precautions of this drug. Olmesartan can be given to the pediatric patients, but in the children with age less than 1 year, this Olmesartan should not be given. Because during the first year, organs are going to be developed and this Olmesartan acts on renin-angiotensin system, so it can affect the functionality of the renal system. Therefore, in the pediatrics with age less than 1 year, if this Olmesartan is given, it can impair the renal activity resulting in the immature development of kidneys. That's why this drug should not be given to the children with age less than 1 year. And even this drug is safe in the children with age 6 to 16 years. So less than 6 years, again, this is not preferred. And in the children with age less than 1 year, it severely impairs the renal functionality. Similarly, another important precaution of Olmesartan is that this drug is going to block the renin-angiotensin system. Therefore, this drug should not be given to the pregnant woman because it can affect the development of the fetus in the pregnant woman. Particularly, Olmesartan should not be administered in the second and third trimester of pregnancy in order to avoid renal damage, because this drug is teratogenic and it can produce fetal damage. So this drug can produce fetal renal failure and fetal lung hypoplasia, decreased development of the lungs, fetal hypotension, and skeletal deformalities can be observed. Even this drug can reduce amniotic fluid, resulting in miscarriage. So all these effects are observed with Olmesartan, so it should not be given to the pregnant woman, particularly at second and third trimester. Just to ask you that Olmesartan is an antihypertensive, it is going to inhibit renin-angiotensin system. So this drug can reduce the blood pressure, resulting in hypotension. When this drug is co-administered with other drugs such as diuretics, it can again produce a hypotension. Drugs like loop diuretics can produce significant hypotension. So when they are combined with Olmesartan, they can produce severe hypotension, which should be avoided. And Olmesartan should be carefully given in those patients who are salt depleted or those patients who are already suffering with hypotension due to loss of minerals, dehydration, diarrhea. In such conditions, this drug may further increase the hypotension. Another important precaution is that this drug is going to acting on the renal system. On the renal organ, it targets renin-angiotensin system. Since this drug is going to inhibit the activity of RAS, it may develop acute renal failure, resulting in few other symptoms such as oliguria, decreased urinary output, azotemia, the decreased blood urea nitrogen, and even it can produce hyperkalemia. All these effects are observed with Olmesartan on long-term use because of reduced renal functionality. So care should be taken to check development of any of these symptoms, and renal functionality should be measured on very long-term treatment with Olmesartan. Now let us see how this drug acts. Angiotensin 1 is a peptide with 10 amino acids. So it is going to be converted by one of the enzyme AC, angiotensin converting enzyme. This enzyme is going to remove the 2 amino acids such that it produces one of the mediator, angiotensin 2. Angiotensin 2 is having the 8 amino acids. From this angiotensin 2, one of the amino acid is going to be removed such that it is going to form angiotensin 3. Another amino acid is going to be removed to produce angiotensin 4. But among these mediators, angiotensin 2 play an important role in producing vasoconstriction, which is blocked by Olmesartan. Now, angiotensin 2 can act on two types of receptors. AT1 receptor, which is the receptor for angiotensin 2 type 1. Similarly, it can also act on AT2 receptors, which is again a receptor for angiotensin 2 with subtype 2. By acting on AT1 receptors, it can produce vasoconstriction, increased aldosterone release, and hypertrophy proliferation. By acting on AT2 receptors, it can produce vasodilatation, decreased proliferation, and apoptosis. Now, action on AT1 receptors are mainly responsible for development of hypertension. Therefore, Olmesartan selectively blocks the action of angiotensin 2 on AT1 receptors. Now, on the blood vessels, AT1 receptors are present, which are G protein coupled receptors coupled with alpha, beta, gamma subunit. These are the receptors for angiotensin 2. Now, angiotensin 2 can act on AT1 receptors, which activates the phospholipase C system such that they can convert the phosphatidyl inositol biphosphate into two fragments. One is IP3 and second one is DAG, diacylglycerol. This IP3 can act on the IP3 receptors which are expressed on sarcoplasmic reticulum. By acting on these receptors, it can increase the release of calcium, so calcium is more released into the cytoplasm. The diacylglycerol can activate the protein kinase C system, which is going to open the inward going calcium channels through which calcium can enter into the membrane. In this way, intracellular calcium levels are increased, which produce contraction of the blood vessel. Now, Olmesartan is a ARB angiotensin receptor blocker. It can block the activity of angiotensin 2 receptor subtype 1, thereby it can produce relaxation of the vascular smooth muscle. In this way, Olmesartan reduces blood pressure. Now let us see the side effects of this drug. One of the important side effects of this drug is the dizziness, which is commonly observed in many of the patients, and it can also produce some back pain, some diarrhea. Other side effects mainly include headache, rhinitis, sinusitis can be observed with this drug, and this drug can also produce some asthenia, some lack of energy can be observed with this Olmesartan. How it is given? This drug is available as a tablet at different strengths such as 5 mg, 20 mg and 40 mg. The initial dose is started at 20 mg per day, given once daily. The dose can also be increased up to 40 mg based on the efficacy of the treatment after 2 weeks. In the children with body weight less than 35 kg, this drug is given at a dose of 10 mg as once daily. But in the children with age greater than 35 kg, it can be given at an initial dose of 20 mg given once daily. So that's all about this ARB Olmesartan. Olmesartan is a imidazole containing angiotensin receptor blocker. This drug blocks angiotensin 2 receptor subtype 1, by which it can inhibit vasoconstriction resulting in vasodilatation. So this reduces the blood pressure, and this drug can be given as an ester form such as Olmesartan medoxomil, which can be given either alone or in combination with few of the diuretics such as hydrochlorothiazide or chlorthalidone. But this drug should not be given to the children with age less than 1 year, and it is strictly contraindicated in the pregnant women. This drug can be given in the children with age 6 to 16 years to control the blood pressure. Dizziness, diarrhea and back pain are the important side effects produced by this drug, and this drug is started at initial dose of 20 mg, which can be further increased up to 40 mg based on the efficacy of the treatment. So that's all about this drug, Olmesartan. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.